So I'd like to welcome everyone. My name is Kimberly Chambers and I use she, her pronouns. I'm the founder of NoCoSafeSpace and I'm delighted to be here tonight as we collaborate with the Larimer County Health Department. Since we are still connecting in virtual spaces, there are only a few things like housekeeping items that I would share. First, I'm really grateful that we can provide gender neutral restrooms to everyone watching from home in your home. And I'm pleased to let you know that at the end of this presentation, you'll have access to put yourself and your family on a reservation list for upcoming MODERNA vaccine clinics that are specifically designed to be LGBTQIA affirming and intentionally inclusive. There will also be a way for you to get connected to additional vaccine clinics if a different one suits you better. When attending these LGBTQIA vaccine clinics, people who use different or more fitting names will have exclusive access to receiving a second vaccine card in their chosen name, as well as the typical one in their legal name. This is to ensure that our queer identities and names do not hold us back from having access to the COVID-19 vaccine. For further information on that, I'll put email in the chat. During this presentation, you can use the Q&A feature if you're watching on Zoom, or comments in the Facebook Live event, and our guests will address your questions after their presentations. If you have questions that you would like to ask confidentially, you can text your question to the NoCoSafeSpace text line, which I will put in the chat. It's 970-614 LGBT 5428. Looking for the chat right now. Don't know where that is. I would like to now introduce and welcome our guests from the Larimer County Department of Health and Environment Population Epidemiologist, Jared Olson. Dr. Olson uses he, him pronouns. He's the population epidemiologist for Larimer County and has been following the COVID-19 pandemic very closely. He reads about transmission, variants, and vaccines, so you don't have to, unless you think it's fun like he does. Dr. Olson combines community engagement, health equity, and epidemiology as a public health practitioner. He's been accessing data and collaborating with partners to prevent cases and maximize vaccinations during the pandemic. We'll also feature tonight two local medical providers who are known within our queer and trans community to be knowledgeable and affirming. Physician assistant Emma Richardson. Emma uses she, her pronouns and is a physician assistant at Associates in Family Medicine. She's passionate about social justice and healthcare equity and specializes in transgender care. She has a dry sense of humor from New York and loves taking care of her patients. Lastly, we'll hear from Dr. Stacie Johns, who uses she, her pronouns. She was born and raised in Michigan and did her undergrad at Wake Forest University, followed by medical school at the University of North Carolina at Chapel Hill. After finishing her residency in family medicine, she relocated to Colorado in 2010. Since 2010, she has been practicing full spectrum family medicine at several different locations. She focuses on treating the whole person and works in a very collaborative fashion with her patients. She has a passion for transgender care and loves to continue to expand her areas of medical knowledge. Personally, she's a mother of two young boys, ages 7 and 10, and has raised 11 guide dogs for the blind. She loves to ski, hike, scuba dive, and travel. Thank you for helping us understand the best medical information and what we can expect from receiving the COVID vaccine. And I will pass it off to Dr. Olson.
That's great. Do you want me to run my own slides or would you?
Yes,
okay.
Please.
Super. All right, let me get to share here. All right. Okay, so I just wanted to talk a little bit about overview of vaccines and vaccination. And thank you all, first of all, for being here and for joining in tonight. I hope we can answer any questions that you might have either through our presentations or through the Q&A a little bit later. So let's see. First off here, just kind of 3 points I want to touch on. Oops, excuse me. So vaccines provide strong personal or individual level protection for severe disease, hospitalization, and death. So protection from those really serious outcomes from COVID-19. Widespread vaccination in our communities can also help crush our cases, really bring our cases down, and will help bring us back to a normal-ish life, right? Something that we were a little bit more acquainted with before COVID. And I just want to emphasize, because there's been so much discussion about variants, there's some folks who are calling them scariants, and there are some scary features to them. But I just want to assure you that the vaccines that we have right now are very effective against the variants that we are facing, particularly in Larimer County. And then lastly, I'll just say, any questions that you have or any uncertainty or hesitancy, I think is totally normal. This has been a very long, very confusing year, and everyone is just kind of doing their best. So, you know, we're all muddling through, and hopefully we can help each other in that way. All right. Okay, so I just want to talk a little bit about the vaccine clinical trials. So you'll see here over on the left are the 3 vaccines that have been administered in our county thus far: J&J, Pfizer, and Moderna. We all know that there's been a pause on the J&J because of a literal 1 in a million event, right? So there's been about 7 million doses of Johnson & Johnson in the US, and we've found, I think it's up to 8 cases now of some severe blood clotting, so right around 1 in a million. So the FDA and the CDC have put a pause on that and are investigating that in order to ensure safety for their patients, and then also communicating with doctors so that they know what to look for with their patients. But we're continuing to vaccinate with Pfizer and Moderna until J&J comes back online. But the protection afforded by these vaccines, all 3 of them, is really quite spectacular and quite a scientific achievement within a year. So it's a real credit to the mRNA vaccines and the J&J vaccine as well, that we can ascribe 100% protection from death and hospitalization to the clinical trials of all 3 arms, and really high levels of protection from severe infections. So severe infections would not even be hospitalized infections, right? So severe is a severe case, but not necessarily hospitalized. And we see strong efficacy even for mild COVID, right? And so we're actually seeing declines in transmission. So we have a couple of real world case studies of places that are more vaccinated than we are in the US, Israel and the United Kingdom. So let's take a look quickly at Israel, the most vaccinated country in the world right now. The vast majority of their cases since they began their vaccination campaign, December 20th, have been among unvaccinated individuals. Then second, but much further down in second place, is this less than 14 days after they get their first dose, more than 14 days after their first dose, and then two doses, but less than 14 days. And then finally, this very slender green stripe here, 2 doses greater than 14 days. So there is the possibility of COVID infection after 14 days, but there's no comparison between the number of folks who are getting it unvaccinated and the number of folks who are coming down with COVID once they are vaccinated, and we know that the severity is much less. And then just looking at the same sort of data over time. So unvaccinated cases per 100,000 decline. First dose case rates also decline, especially once you hit about 45–50% with the first dose in Israel. And then the second dose rate per 100,000 stays low, but also declines at the same, in a similar sort of pattern. Okay, so let's talk about variants for a second. In our county, we have really 2 variants. We have a third one, but it's associated with a travel case, so we don't have any evidence that it's transmitting within the county right now. But really, we're looking at the California variant and the United Kingdom, the B117. So the big feature with the B117 variant, as opposed to the kind of wild type that preceded it, is that it's much more transmissible. It's able to be passed more easily. So you can kind of think like if you were in a room with some individuals unmasked without the B117, maybe a smaller number of those individuals, maybe individuals who are closer or who are in the direct line of the circulation of the air might become infected. but maybe a greater number would be if the B.1.1.7 variant was present, right? So it's just a little more, it is substantially more, I should say, infectious. However, we don't see significant reductions in the efficacy of the vaccines with the B.1.1.7. And both Israel and the United Kingdom, those are the predominant strains. Those are the ones that are the ones that are moving around in those communities. And we've seen mass vaccination really effective with those locations. So I do want to point out one little difference, or one substantial difference, which is that Israel and the UK both had significant lockdowns that preceded their vaccination. But what we're looking at most recently with Israel is this little plateau in their case rate, right? This is pretty comparable to where we are. We're actually maybe a little bit below this in our case rate. And once they vaccinated to a great degree, right? So we're seeing here first dose, at least first dose, approaching about 55% of their total population. We see this significant decline, and then it remains quite low, and it continues to decline, even though their vaccination rate slows, right? So they haven't actually even hit 60% first dose quite yet. They're still making their way to that. They've slowed down in their vaccination rollout, and we'd like to continue to push ours, well past 60%. Right now we're at 53%, about 54%. Of our eligible population 16 years and older has had at least one dose, and that translates to about 45% of our total population. So we're getting closer. And then I'll hold on to this, but maybe I'll share it with Kimberly, who can share it in the chat. But if you have some questions about how mRNA vaccines work, because that is a vaccine technology that's relatively novel. It's been in development for over a decade now as a technology, but this is the first time we've really seen it in vaccines specifically. This is a great little explainer. It's a TikTok video, less than a minute. So with that, I'll stop and hand it back to Kimberly. And she can pass it on. Thanks very much.
Thank you so much. We really appreciate your time this evening. I'll pass it off now to Emma Richardson and Dr. Stacie Johns.
Okay, so I'm going to not be technologically challenged and work and share my screen.
This Emma.
Okay. Can you all see that?
Looks perfect.
Okay. So Dr. Johns and I are going to go through some of the aspects of the vaccine. Jared did a great job of touching on COVID-19 in and of itself. So we'll just kind of briefly touch on that. So if for those of you who like the book in the time of love and cholera, hopefully not as bad as cholera. So just so you all know, so a little bit of the landscape of COVID-19, I know there's been a lot of back and forth about where we're at, but currently Larimer County is at level blue, which if you see a lot of restaurants opening back up, a lot of like to full capacity, as long as they're as long as patrons are able to stay 6 feet apart. Some information about our numbers as of the 15th, as you can see, peak cases are around 6,700 people. And then really, declining, now starting to come back up, potentially plateauing. So 1,600 cases as of April 15th. And you can see just the number of deaths, 6,000 deaths, 26,000 hospitalized. It's a pretty intense toll that it's taking on our county. Again, just about the variants, that it's more easily transmitted, but it still should be detected via the PCR test, which are those nasal swabs that are less intense now as well. They used to be very far up the nose, and now they're a little bit closer to the outside, and the vaccines do appear to be effective. Dr. Johns, if you want to touch on some of the COVID-19 symptoms.
Absolutely. So symptoms for COVID-19 can be a little bit all over the board. You can have very mild to moderate symptoms, including the basic fevers and chills and coughs that you would associate with other similar viruses or colds. Specifically to COVID-19, though, you can get a really fairly quick onset of shortness of breath and chest pain. You also can get very tired and fatigued. Similar to like flu and other colds, you can get a lot of body aches, you can get headaches, sore throat, congestion, nausea, vomiting, diarrhea. So you can see it's difficult to tell this apart from many other illnesses, which is often wise. If you have any of these symptoms, it's just best to get tested. Of course, the one that is very specific to COVID, of course, is new loss of taste and smell. That's something that we don't see with a lot of other viruses. So that, of course, is really kind of nice when it happens, because then you know for certain that's what you have. More severe symptoms are going to be respiratory distress, and that's going to be severe difficulty in breathing, acute failure, which is where you're going to actually need help with a breathing machine to help breathing. Other things such as multi-system inflammatory syndrome in children's, which is where they get extreme inflammation throughout their entire body, and their organ systems pretty much shut down from the amount of inflammation that they have. And then you can get all sorts of different post-viral syndromes that we're seeing in kind of these long hauler conditions that we're calling them, which is just chronic fatigue and different long-standing chest pain, and numerous other syndromes. And then, of course, the one we really don't like to see, and that's, of course, death. Hope no one gets that, but unfortunately it does happen. We're going to touch a little bit on the various vaccines that are available, as well as a little bit about how they work, since some of them are really new. Just to start off with, as far as the benefits of getting a COVID vaccine, first and foremost, they're very safe and effective. The biggest benefit is that you will not get extremely sick with COVID-19 if you get vaccinated. Like we learned earlier, there's a slim chance you could get COVID-19, but your likelihood of becoming extremely ill or dying from it becomes pretty much zero, because in the trials, no one was hospitalized that received their vaccine. So that's a really huge benefit. And getting vaccinated is one of the best things you can do for the people around you that you love, because by you getting vaccinated, you're protecting those around you, and you're protecting those around you that can't get vaccinated for whatever reason, by you not getting the virus and giving it to them. Then another big thing is you can socialize with those that you're close to. You can be around them, and if they've had their vaccine, you can be around them and not be fearful. Please note, though, that if you are vaccinated, you do need to continue social distancing and wearing a mask in public spaces. That is still an important thing to continue. Oh, and the best benefit, they're free. This is one vaccine we don't have to pay for. So thank you, government, for that one. Emma, why don't you continue?
Sure. So just some general information. Some of this we'll kind of double back on at the very end, but to address some questions about for those people who are pregnant or lactating, mostly nursing, the risk of actually getting COVID-19 is much worse, and the actual symptoms that you get are much worse. The risk of death is much higher than actually getting the vaccine. So increased risk of more severe symptoms than non-pregnant peers. There's absolutely no evidence of infertility with the vaccines, and really the recommendations by numerous, physician and other healthcare organizations, including ACOG, which is the American College of Obstetrics and Gynecology, recommends that the vaccine should be offered to all pregnant and lactating individuals. Really, any underlying medical condition, whether it's immune deficiency or heart failure, or you've had a heart attack, or you have diabetes, like really anything, they are not contraindications. Honestly, the worst condition that you have, the more important it is to get the vaccine, because the risk of getting COVID-19 just has the potential for much more dire outcomes. Of course, able to gather indoors without physical distancing, as Dr. Johns touched on, and then based on what we've heard from the CDC, if you've received the vaccine, then you're not really required to quarantine afterwards. We're not totally sure on the amount of time after you get the vaccine, but it seems at least 3 months. So it is possible to get COVID-19, but it's very rare, of course, spelling error here, but the actual likelihood of getting COVID-19 is very unlikely, and it's much, much, much less likely to be severe. Of course, we know that it's possible to transmit COVID-19 in whichever case asymptomatically. That's why it's important to continue to practice social distancing and wearing a mask in public spaces where you don't know who has been vaccinated or not. So if you already got COVID-19, you already had the illness, it can offer natural immunity, which means that just by getting it, your body can produce antibodies, which then can protect you against future COVID-19 infections. And in fact, reinfection is uncommon initially, but it's still possible as time goes on. In addition, the risk of severe illness and death, DTH, from COVID-19 definitely far outweighs any benefit of natural immunity, which means that we wouldn't want to just risk you getting COVID-19 as opposed to protecting you with the vaccine. So the CDC does encourage people to get vaccinated regardless of prior COVID-19 infection. So if you had COVID-19 and you were treated in a very specific manner with antibodies or convalescent plasma, you should wait 90 days so that your body doesn't have a stronger reaction. But yeah, of course, you're able to get the COVID-19, but you can wait because you might have that sort of natural immunity before getting the actual vaccine. Dr. Johns, if you want to talk about side effects.
Absolutely. So I'm sure you've heard lots of things about the different side effects that you can get from the vaccine. And I'll tell you, in general, they're pretty mild. And I would say in general, probably about 2/3 of people have very, very limited, if not any, side effects. I would say the majority of people will have a little bit of pain at the site of the vaccine, kind of similar to a tetanus shot. I would say in my experience, it was a little bit more sore than a tetanus shot, but it went away really quickly. I have seen some people who have had some redness at the site that's been staying a little longer than we would expect. And by that, I mean maybe 1 to 2 days, but it's not the redness of infection. It's just a redness on the skin. That's not worrisome or concerning. It's just there, and it goes away quickly in a day or two. Some people will have some mild swelling at the site, but again, after a day or two, it goes away. I'm sure what you've heard mostly from people getting it is the kind of body aches, fatigue, tiredness, headaches, kind of nausea. And you know, the thing about these side effects is if you get them or you don't get them, it doesn't mean that your vaccine worked or didn't work. Some people will get them and some people won't. What happens is when we get a vaccine, our body produces a ton of antibodies. And as we produce antibodies, we produce these lovely chemicals called cytokines. And these lovely cytokines are things that are produced when we have viruses and flus, and it's part of our body's process of making antibodies. And unfortunately, these lovely chemicals that help us get better also give us headaches and fatigue and body aches and chills and fevers. But they're a natural process of our body making antibodies. And unfortunately, some of us, as we make those, just feel them a lot more and get that tiredness and those body aches. Fortunately, it goes away really quickly. For most people, it's 1 day, 2 at most. But you can really go about your business and do whatever you feel comfortable to do and whatever you feel that you are safe to do. There has been a lot of media about whether or not it's safe to take ibuprofen and Tylenol with regards to symptoms and side effects. Current guidelines are recommending that at the time of the vaccine, you do not take ibuprofen because we don't want to hinder your body's natural immune response to have a natural response to the vaccine. However, after you do get the vaccine, you know, shortly thereafter, such as the next day, if you are achy or have headaches or body aches, you are welcome to take ibuprofen or Tylenol without having any consequences to the vaccine itself. We just ask that you not take it prior to, like, right before having it administered. And it is a little bit more common to have the side effects after the second dose than the first, but in the majority of people, the side effects are pretty mild. As far as location for vaccination, you can always reach out to your primary care physician. I know lots of my patients have reached out to me. One of my best resources is I refer people to the Larimer County website because they have a fantastic link that shows all of the different places you can register for vaccines in the county, which has been really fantastic. The UC Health website now is really, really super quick. You can go on there now and register, and you can actually get a vaccine today. It takes about 2 minutes. I did it with one of my patients today. You can go in, you register, pick a time, and off you go to get your vaccine. So it's really pretty easy and quick and straightforward. You can also get it at pharmacies like Walmart, Sam Club, Safeway, Costco, King Super, Walgreens, all those different places. Yeah, you want to take over that, Emma? That's the fun stuff.
Sure. Yeah, we're going to get into a little bit of the nitty-gritty of the different types of vaccines. So the 3 vaccines that are out now in the United States, Pfizer, Moderna, and Johnson & Johnson. Now we know that Johnson & Johnson is on pause. So I'm going to sort of glide over that a little bit. But I want to make sure to address, particularly people's questions at the end about what happened and side effects and things like that. So Pfizer is offered to people 16 and over, Moderna 18 and over. They're both 2 shots. One is 3 weeks apart, the other 4 weeks apart. And that helps, they act as sort of immediate boosters. And so you're considered fully vaccinated 2 weeks after your 2nd shot. So I'm going to try to play, this is actually a short video that I'm going to try to play because I feel like people have a lot of confusion about what actually mRNA vaccines are. And, a picture is worth 1,000 words and maybe a video is worth 1,000 pictures. So let's see if we can do this. Play. Let's see if we can play. Uh-oh. Whoops. Play. I was just working. Let me see if I can try one thing here. Can you all see that?
Mm-hmm.
Okay.
Yeah, no, we don't have any sound.
Oh, you don't have sound?
No.
Oh, okay. Well, maybe, so here's what I'll do. Well, maybe when we share it, we can include the link, and I'm going to go on to kind of explain a little bit about it.
Okay, that's perfect.
Would that work?
Yeah.
Okay. Sorry about that. I told you, technology, and really tried. All right. Oh, were you here? No. Okay. Anyway, you don't hear it now? Okay, that's okay. Okay, so again, pictures, amazing, the CDC website. So a little bit about mRNA vaccines. So what the actual vaccine does is it takes RNA and it actually, oh, sorry, children. So it gives instructions, so which is the mRNA for cells to make this harmless piece of the virus called spike protein. And so the spike protein is found on the surface of the virus. You've seen all the beautiful pictures of COVID-19. And so what happens is that mRNA comes into our body, then we're able to make these spike proteins and put it on our cells. And then we produce these antibodies that we were talking so much about that can then protect us when our body actually comes in contact with COVID-19. It doesn't create COVID-19 in our bodies. It doesn't change the DNA. And it doesn't make us sick with the actual virus. Any symptoms that you get are just your body kind of learning how to mount an immune response. So I like this graphic because it sort of takes you through it. It's a little bit wordy, but we'll have it available for you, and it's on the CDC website. So just briefly about Pfizer, and then we can talk about Moderna. So actually we'll talk about both. So Pfizer and Moderna are very similar. They're both mRNA vaccines. This is 2 shots, 21 days or 3 weeks apart for 16 up, 95% effective, 95% effective at preventing COVID-19, which is super, super high and blew everyone's minds when we found out about that. Really no allergy that we know about is contraindicated. So there's no eggs, preservatives, or latex. And like we said, the most side effects are after the 2nd dose. And then, you know, most mild to moderate side effects, although there are some people who had severe side effects, those tend to last 1 or 2 days and are not extraordinarily debilitating, which is good. Very similar with the Moderna, 28 days instead of 21 for 18 and above, and very similar in effectiveness, 94.1%. So they're really essentially the same. No eggs, preservatives, or latex, really, and the rest is the same. So, you know, one of the biggest things is that it's found to have high effectiveness in clinical trials among peoples of diverse age, sex, race, and ethnicity categories, and among people with different underlying medical conditions, which is why nothing's really contraindicated. Dr. Johns, if you wanted to talk about kind of the vector vaccine.
Yep, I want to chime in too and just say that both Moderna and Pfizer have started trials on younger patient populations, and they are doing 6-month through 18-year-old trials as we speak. And we are hoping by January 2022 that we'll be able to vaccinate everyone from 6 months on. And the data is looking really good so far, and it's even possible that by fall we'll be able to do 12 years to 18. And so that's really encouraging that that's coming. And so just to let you guys know that that is in the works. The other things is I do a lot of work with people with severe allergies called mast cell syndrome. And a lot of my patients have had this vaccine with absolutely zero reaction. And these are often people that like react to the world just by looking at it. So that's really reassuring that these are truly vaccines that people don't react to. So that's really good. As far as how a viral vector vaccine works, this is a little bit different. And this is where we actually create a vector. And I like to think of this as kind of like a little spaceship that goes into our body. And basically it's another little virus that's incredibly harmless. And it enters into the cells in our body and it uses our own cells machinery. So it kind of, I don't like to use the word hijack, but it kind of uses basically our own body's production system to make a piece of the virus, again, the spike protein. And we use the spike protein over and over again because we don't have any spike proteins in us, so that these vaccines can never mistaken our bodies, and will always only attack the virus. And so once these cells then display these spike proteins on their surface, the immune system recognizes them as foreign, again, makes lots of antibodies, activates our immune system in similar fashions as the previous discussion. And our bodies now have lots of antibodies to fight off virus when it sees it the next time when you get COVID. I think these are also really great graphics. So CDC does such a good job with these. So very similar kind of ideas, just little slightly different ways as to how they get it into us. But again, not entirely restructuring us or causing any harm to our bodies in any way. The Johnson & Johnson vaccine is, of course, the viral vaccine, vector vaccine that we are familiar with. It uses a modified version. It delivers the instructions to our immune system. And currently, this is the one that you're hearing in the news right now that is on a pause. The side effects are most common between just the 18 and 59-year-olds versus over 60. It's not nearly as effective. However, it is still very effective at preventing severe illness and hospitalization. And no one got COVID at least 4 weeks after receiving the J&J vaccine, and no one needed to be hospitalized. So this also vaccine does seem to be providing protection against asymptomatic infection, which is really good. The do we have, we don't have other slides, Emma, later on about the current information, do we on this? Oh, you do right there, next slide. Ah, you're so smart. So the rare causes of blood clots with regards to J&J came out about 3 weeks ago. This is very, very, very low. So less than 1 in 1 million. And your actual risk of getting this is extremely low. And where I think that this comes into concern for a lot of people is, what if I'm on hormones? What if I'm taking estrogen? What if I'm female and have estrogen? You know, all of these kind of clot producing things. You know, we all think of estrogen as being an increased risk for clotting. And everyone that has produced clots in these trials has been women. But again, I want to reinforce that this is 1 in a million. So it's an extremely, extremely rare side effect. But we do recommend that if you get the J&J within 6 to 13 days after getting the vaccine, if you have headache, blurred vision, fainting, seizures, you know, the chest pain, the swelling, the shortness of breath, any sort of petechiae, which are these little red spots that don't go away when you push on them on your skin, that you do get evaluated. I don't really think there's any concern, in my opinion, with regards to whether or not you're on HRT with either the Pfizer or Moderna vaccines. I have absolutely no concerns or fears with any of my patients on HRT receiving any of the vaccines, and I'm even fairly comfortable with them getting the J&J with the absolutely low rates. I think we need a little bit more data, and I think the CDC will come out and tell us their opinion on the J&J in the next week or two on that.
And just one more thing, you know, most of the time when we talk about HRT, folks are on bioidentical estradiol or 17 beta estradiol. And the studies that were done on estrogen in terms of blood clots are ethinyl estradiol, which is in birth control. So the risk is already low.
That's exactly right.
So we're going to just quickly shift just a couple of questions, just kind of address some of the concerns. Some of them will be a repeat, so I try not to spend too much time on that. And so then we'll welcome your questions at the end. So, you know, some people think it's not safe. The FDA goes through a rigorous process to determine safety and efficacy. So they've determined that they're safe and efficacious. They still have to follow the same guidelines in order to be produced. Yes, they were produced more quickly, but they got some of those licenses more quickly so they could proceed with the actual trials as opposed to kind of waiting on them, which is what normally happens. But they are definitely safe and effective to use. Will it alter my DNA? No, straight up, no. It doesn't enter the cell's nucleus, which is where the DNA is. So it is unable to affect the DNA. No evidence of sterility, infertility. I'm not actually sure where that rumor came from, but there's absolutely no evidence, particularly because it doesn't affect the DNA. Will it be effective against new strains? Again, yes, it should be more effective. Really, the difference between the new strains and the sort of old one is transmissibility, so you can get it more easily, but the actual treatment seems to be in line with treating the original COVID vaccine and the variants. It is impossible to get COVID-19 from the vaccine. And I want to be really clear, this is, although you can have sort of like COVID-19 like symptoms, it is an impossibility to get COVID-19 from the vaccine. In the same way that it's impossible to get the flu from the flu shot, even if you have sort of flu-like symptoms. Dr. Johns, if you want to take some of these.
Sure. Side effects from the vaccine are worse than getting COVID-19. This is definitely not true, because dying is definitely a worse side effect than the vaccine. I say that with some sarcasm, but it is definitely true. The side effects from the vaccines are only going to last a day, and you'll be back on your feet with no problems. And most people don't have significant side effects that are worth complaining too much about. So by all means, that's not true.
And I will just add one thing. Some people think, you know, I'm young, I'm healthy, I don't have any medical conditions. You know, there are lots of people who are young and healthy who have very severe effects. and then who are dealing, in our practice, we see people who are dealing with months, now a year worth of these bizarre changes. Their body doesn't know how to react to things. All of a sudden their heart rate is going up. They're short of breath from things that are random. Their blood pressure is all over the place. They feel sick. They have fibromyalgia, like new diagnosis. So there are lots of things that can affect even a young, healthy person. We really, really recommend it for everybody. Go ahead.
I've already had COVID-19, so I do not need to get a vaccine. From all the data, it seems like getting it is only protecting you for about 3 months. So after that, you can be reinfected. And even prior to that, there's some definite evidence that you can become reinfected. I have seen it in my patients. And with some of the newer strains, we do worry about reinfection, and it's just not worth the risk. So it's definitely worth getting vaccinated. Absolutely. Can I test positive because I got the vaccine? We do not use a live vaccine. So no, you will not test positive if you've had the vaccine. Just no clear way to say that.
Oops.
This is another really clear one is, can I stop wearing my mask after I've been vaccinated? And that's a very clear no as well. And that's simply because especially right after you get your vaccine, you have to remember that for several weeks after you get it, you're still building your antibodies. So it is super important after initially getting, especially your first one, that you continue to wear your mask and continuing to wear your mask after you've been fully vaccinated, because it is preventing you from getting sick with COVID-19. But we don't know entirely about how it prevents you from being able to spread it without symptoms. So it's really important to make sure that you're not contributing to asymptomatic spread and that you're keeping everyone around you and your community safe and continuing to wear your mask.
Thank you.
Thank you.
Perfect. I want to thank you all again for your presentations. We have a couple of questions. And you are welcome, folks, to use the Q&A feature to type in any questions you have. We're also monitoring Facebook Live. So if you're watching from there, you can type your questions in comments and we'll get them answered. The first one that came up, which you kind of addressed, but if you'll just give a direct answer. Are there concerns being on hormone replacement therapy, so testosterone, estrogen, et cetera, and getting this vaccination?
No, yeah, pretty clearly no. Again, the people who were affected were cis women, so there is a higher level of estrogen. They were not on exogenous or sort of outside estrogens. The higher risk of blood clots in general, again, are from oral birth control pills, which is a different type of estrogen than that is used in HRT. And really, I mean, these types of blood clots that were caused by the vaccine are like a completely different type of blood clot than we normally think. So we normally think blood clot in the leg, your leg is swollen and red and hot and painful, or blood clot in your lungs called a PE. So you have very sort of focal shortness of breath or chest pain and high heart rate. These were like sort of disseminated blood clots in the brain and really low platelets. It's a completely different disease process. So short answer is no.
Thank you very much. Another question from a viewer. How do we advocate for universities and other organizations to mandate people getting a vaccination for COVID?
That's a tough question to answer. I think it's really hard to, I wish we could, but I think that's a tough one to answer directly. I think one of the best ways we can do that is by all getting vaccinated yourself and not being afraid to share that you've been vaccinated, that you've had an okay experience, that you've not had any significant problems with it. I think it becomes a very, for some people can be a very political, dicey conversation. And I think we have to be kind and cognizant how we speak to everyone, and be aware of that everyone has their own right to have their opinions. But I do think we can lead by example and get vaccinated and show that we're not afraid to do so, and wear our masks and demonstrate that we are keeping all of each other safer by advocating that we get all of our communities vaccinated, so we can keep all of ourselves, as well as those that are at higher risk and can't be vaccinated for whatever reason, safer by doing so. I know that's kind of a wishy-washy answer, but I don't have a great answer to it, but if anybody has a better answer, go for it.
I would definitely say, you know, if you feel really strongly about it, I would contact the people in charge, I guess, you know, the people in the administration, the president, the vice president, human resources. You know, if you feel really strongly about it, you know, they have to take it seriously when tens, hundreds, thousands of people are voicing their concerns. You know, there have been other cases in a variety of institutions, even like elementary schools, where they require certain types of vaccinations in order to attend. I don't know how that would even work with universities. Could they limit your activity in sports or in-person, you know, in-person classes? That is like such a large, diverse, just a much longer conversation about like the ethical, just the ethics behind it, and why you would make that choice. And I think at the end of the day, it's a totally, it has to be individualized, you know, with universities. And I'm very interested to see how it plays out. But I think if you feel strongly about it, then you should actually like say that to your university.
Anything from the health department on that side?
I don't think that as a health department or as a governmental agency that we'll have a role in regulating or requiring vaccination in any form. There certainly are some universities and private businesses out there that have decided to require either proof of immunity or recent negative test or vaccination in order for specific events where they want to reduce the risk. I think Brown University is requiring vaccination prior to returning. So, you know, that's going to be on a organizational by organization basis.
I want to just piggyback on what Dr. John said as well, is that, you know, thinking about just getting more people vaccinated, you know, wanting us to have, you know, just inch closer to herd immunity. You know, Jared, you had a great study about Israel, and you know, their vaccination cases went up, and then their COVID vaccines went down. I mean, what we're seeing with these vaccines is that the people in charge, the rabbis in Israel and the imams in the Middle East, they are the ones getting vaccinated, and they are the ones who are saying, look, I'm okay, I'm feeling good, please do this. And so, you know, being more vocal and being a leader in your community and really taking charge, I think is better than any video, than any handout, than any fact. Is just saying, I did it, I'm feeling good, I hope you do it too.
Mm-hmm. There's a couple questions in the chats I can answer here. There were 2 questions here about if you have an autoimmune disease and can you get the vaccine, and does it give you the same type of protection versus if you do not have an autoimmune disease? And then a subsequent question if you're on immunosuppressants for various diseases, like either a liver transplant, or let's say there's a lot of people that are on things like, comes to example, like Remicade or medications for like rheumatoid arthritis or multiple sclerosis or something like that. This is a tough question because we don't have a ton of data around these. What we do know is that they're safe to get in these situations. Lots of my patients in both of these similar situations have received the vaccine and have tolerated it just fine without any side effects. What we don't know is exactly how much protection they're going to have. We think that based on the processes with which the vaccines produce immunity, that they should have some significant vaccine and protection. we just don't know if they will have a little bit less than the average person that's not on immunosuppressants. And this goes back to the same idea of why we need herd immunity, because there are people, you know, that are that have to naturally suppress their immune system so much and can't be entirely protected and can't mount a good immune response to vaccines. And those are the people that as a society we need to help protect by having us have strong immunities so that we don't pass it on to them. So I would encourage them to get vaccinated if they feel and their specialists feel that it's safe, which I do, and all the studies show that it is, that there's no harm to them. Whether or not they'll be protected at the same 95 percentile is yet to be shown, and I think we will have that data hopefully soon in the next year or so as we are getting more people vaccinated and we have more studies.
Thank you.
And of course, we did both get vaccinated. Go ahead, Emma. I'm sorry to interrupt you.
Well, I just realized when we were talking about HRT, we didn't talk about T itself, and so just no, you're good if you're on T. Please get it. But I just realized that I didn't actually say that.
So in general, the only potential concerns that people are noting are for those that are receiving estrogen. And it's not even a large number. It's a super.
No, not even. I wouldn't even say that there's an increased risk if you're on estradiol. It's just the normal sort of risk, your sort of baseline risk. But really, what it seems like is the process that caused the side effect for the Johnson & Johnson vaccine is completely separate than what we would normally think of as a risk for a blood clot, like in your calf or your arm or your lungs.
Perfect, thank you.
The blood clot from the Johnson & Johnson is thought to be more of an autoimmune type response called HIT, which is a little bit different from the blood clots that we get from like surgery or not moving. So it's a totally different process and works with a different way than would be a clot that would be caused strictly from estrogen. So it shouldn't be linked together.
And just to contrast the two numbers, as both doctors said, it's 1 in a million right now for the Johnson & Johnson complication. Our prevalence is about 1 out of 170 for COVID right now. So that's the kind of radical difference in numbers we're talking.
Thanks for that.
So you're saying I should buy a lottery ticket and I have a slightly better chance than developing a complication from getting a vaccination.
Fly a thunderstorm, those sort of things.
Yep.
Fair. Colorado Lottery, I'll give you my address for the payment on that one. Just kidding. A couple of other questions, which you slightly covered before, so just kind of snap answers. I have a history of allergies. Can I still get the COVID vaccine, and which allergies should I be most concerned about?
Yes and none.
Agreed.
If I've already had COVID-19, can I still get the vaccination? Should I get the vaccination?
Yes and yes.
Yes. So there's some people who are like, who just got COVID recently. Should I get it right now? You can, you know, this is like one of those art of medicine times where, you know, is there a perfect time to get the COVID-19 vaccine? And so thinking about if you just got it, you know, you could theoretically wait a month or two, still of course wearing masks and still social distancing, but because it does seem to give some immunity by actually getting the illness, you could theoretically wait. Now waiting also, you know, again theoretically could allow other people to get it who need it more. So that's like, you know, we're all in this together. So, but please, bottom line, get it. Don't, you know, if you have to get it now or you're not going to get it, then get it now.
Recommendations do recommend that you're symptom-free from COVID before you do get the vaccine. So let's say, for instance, you get your first vaccine and then you are unfortunate and get COVID in between. Current recommendations are to wait a minimum of 10 days before getting your second, before getting the second one, which you have to wait 3 weeks anyways, but depending on when you were to contract it, and be symptom-free. So if you were to get COVID and you're like, I'm scheduled to get my vaccine next week, you'd want to wait till you're completely symptom-free of COVID before you'd want to vaccinate yourself, however long that may take you to recover.
Thank you very much.
Some people who, I'm sorry. There are some people who have developed COVID symptoms the day of their vaccine. I got my vaccine. A few hours later, I started to get really sick. And either they found out that they got exposed or just symptoms were very severe. It is possible that you were exposed to COVID a few days, a week prior, and your symptoms just present on the day of your vaccine. So if you're concerned, please follow up with your primary care provider. You can always consider testing to actually see if you have COVID-19 or if it's just side effects.
Perfect. The last question is, Dr. Olson, do I need to be a US citizen to get vaccinated?
No, you do not need to be a US citizen. There's no payment. We, at all of our sites, I mean, I think maybe I should hand this to Kelsey or Sergio, but it's very simple, it requires very little information, and we want everybody to get vaccinated. We've vaccinated people from outside the state, so we're happy for anybody to come on down.
We do not even require ID, so you don't have to show us an ID. We won't look at it even if you hand it to us. So we do not require ID to get vaccinated. You just walk in and tell us your name. The other thing I will cover briefly is around allergies, is that after you get the vaccine at our clinics, we do observe for 15 minutes. That's just, people sometimes get a little lightheaded. There's a lot of nervousness around this vaccine. So it's not even necessarily a reaction to the vaccine. It's just, it's a weird time with COVID. And then there's a vaccine and lots of misinformation. So we do see people coming in nervous, and then some people do have getting a lightheaded reaction to a vaccine. So we just keep people under observation for 15 minutes. If you have specific allergies to like very specific things, we might keep you for half an hour. The other thing I do tell people is if you're nervous, you can stay for half an hour. I'm not going to kick you out of observation at 15 minutes. You can stay as long as you want someone there watching you until you feel comfortable leaving. I mean, if it's like 9 o'clock at night, we might edge you out a little bit so we can all go home and spend time with our families. But if you want to stay for the half an hour observation and have a EMT or medical person observing you, that is fine too. We want everyone to be comfortable. We know that this just makes people a little bit nervous, and although it is extremely safe, it still is, it's been a hard year and a half for the world. So we totally understand the nervousness.
And maybe I'll just,
go ahead, please.
I was just going to give my personal pitch here. So we're a Moderna Johnson & Johnson family. We're split, and both work great. No big deals on either one. But I think both my wife and I, it feels really nice to be vaccinated. It was a lot of fun to go get vaccinated. It was a lot of fun to be vaccinated afterwards. It was fun to call family and be like, we're vaccinated. So I would certainly recommend it. I'd give it my personal recommendation, separate from a professional one.
And I can speak for the Pfizer vaccine myself, also having received it, and I'm in my free zone now. So I can visit with other folks who have been vaccinated as well. I'm going to go ahead and close us out with some information here.
Kimberly, I'm so sorry. Can I just say one last thing?
Of course.
I will say, we are like, for all of you out there, we are all like, yay, vaccines, let's do this. Everyone get vaccinated. But, you know, I'm sure there's some of you out there, you have family members, you have friends who are really nervous about it and really, or suspicious about it, and still have questions and still have concerns. Please, please, please come and talk to us. Come and talk to your provider. There's no stupid question. There's no wrong answer. You know, please come talk to us, because we want to hear your concerns, and even if you don't change your mind, we want to have that conversation. So whether it's someone at the health department or in medical practice or a pharmacist or a friend, just please don't hesitate to open up.
Thank you. That's a great segue actually into closing up. A super special thank you to Larimer County Health Department, including Kelsey, Sergio, and Kendra for helping on the back side of things, as well as our speakers tonight, Dr. Olson, Dr. Johns, and Emma Richardson. I spoke of the upcoming Larimer County Health Department's LGBTQIA Affirming and Intentionally Inclusive Vaccine Clinic. People who use different or more fitting names will have exclusive access to receiving that second vaccine card in their chosen name, as well as the typical one in their legal name, to ensure that our queer identities and names do not hold us back from having access to the COVID-19 vaccine. As we close, I'll tell you that the first LGBTQIA affirming and inclusive vaccine clinic in Larimer County will be offering the MODERNA vaccine. So that's folks over 18. And that will take place next week on Wednesday evening, starting at 5 p.m. in Fort Collins. Transportation may be provided by contacting the Find My Ride, which I will put all of this info into chat right now. And use the form that I posted first, the tinyurl.com/LGBTQ vaccine, to add your name to our registration list, so you can get on that list to attend if you're interested in the LGBTQ specific vaccine clinic. You'll receive the information about that clinic in email, and you'll be able to provide us with some feedback if we learn that other, like, additional LGBTQIA affirming and inclusive vaccine clinics might be needed around Larimer County. I put that information in the chat that includes that reserve your spot link. It will also be shared on social media later. I also put into chat the Find My Ride info. So if you do not have transportation, then they can connect you with transportation. They do suggest that you do that at least like 48 hours in advance. So reserve that now. And then I also put into the chat the general Joint Information Center, the phone number, which is open basically business hours, Monday through Friday. There's a text line listed. And the main link for the Larimer County Health Department's COVID-19 information, which has upcoming vaccine clinics that are not necessarily specific to our purpose, but you can attend any one of them. They have those available on the website. Typically, you can register at the beginning of the week for anything through that week. And then if you have further questions, there's an email in the chat that you can contact about that second vaccine card under your name. Do we have any closing remarks from any of our guests? I really appreciate you being here and taking the time out of your evening after work hours to help us make sure that queer and trans folks are safe and healthy.
No, thank you, Kimberly. Thank you for organizing and putting it together.
Thanks for including us.
Yeah, thanks for letting us be part of this.
Perfect. So we'll go ahead and end now, folks, and we will put more information on social media, as well as NoCoSafeSpace.com has all of the same links. So if you need further info, you can always message us on social media or email any of the links I put in the chat. So have a great evening, be safe, get your vaccine, wear a mask, all of the above. I love you all. Have a good night.
Good night.